Hello, my name is Kenneth Barker. I'm an anaesthetist at NHS Highland and clinical lead for the National Green Theatres programme in Scotland. I work at Raigmore Hospital, which is a district general hospital of about 650 beds, serving a landmass about the size of Belgium, so with rural and remote challenges and opportunities. In 2017, we began to realise that our work environment could be the main source of our personal carbon footprint. And so the Green Theatre project was born, looking at pharmaceuticals, equipment and practices and asking, can we do this better from an environmental standpoint? In working to make surgical theatres more sustainable, we started with anaesthetic gases, and desflurane and nitrous oxide in particular due to their significant global warming potential. By taking grassroots action, working clinicians were able to deliver a significant reduction in the greenhouse gas emissions of our hospital, an 81% reduction in carbon dioxide equivalents, and a 50% saving on the volatile drug budget. The good work was spread and repeated through a newly created clinical network of like-minded colleagues, Green Anesthesia Scotland. We now recognise the contribution of healthcare to global warming, about 5% of Scotland's carbon footprint, and our duty is to reduce that percentage and limit the damage. Educating ourselves and talking to each other about what actions work and what actions don't, and how to influence your clinical and management colleagues is essential to effective change. From small beginnings, we now have members of Green Anesthesia Scotland in almost every hospital, and we work together on the concept of an ideal green theatre. If we think of an empty shipping container, what is the minimum resource needed to provide safe and effective surgery? We probably need energy, but could we source it from renewable generation? We may not need anaesthetic gas scavenging or even 7-bar surgical air supply. Do we even need water supply actually in the theatre? Perhaps not. We should also reassess the culture of single-use plastic and metal items, and where possible, return to cleaning our tools and using them again, and we should always include the planet in every risk-benefit analysis. This is the infographic to communicate the first 11 actions of the pilot. The success of the desflurane elimination programme meant we had £70,000 of recurring savings by 2019. This helped persuade our managers to reinvest in alternate systems, such as the surgical fluid suction system, that discharges direct to sewage and removes the need for transportation and incineration of plastics and water. We also examined patient warming devices that do not need single plastic blankets and cassettes and were lower energy to run. We looked at more reliable ways of switching off high energy systems when not in use, and proper segregation and recycling of appropriate waste. Again, trying to move away from the disposable culture. In addition to clinicians, the Scottish Government has acknowledged the environmental burden of healthcare, and in August 2022, they published the Climate Emergency and Sustainability Strategy. One part of this was to recognise that surgical theatres are the most energy and carbon intense part of the hospital. And so our pilot project was adopted and formalised for national rollout as the National Green Theatres programme. We currently have over 50 discrete actions, most of which are cash saving for your hospital. And like the pilot, they focus on energy use, supplies and equipment, pharmaceuticals and clinical practices. The actions are being delivered in bundles of 5 or 6, and they're released every 6 to 9 months. The working model for the Green Theatre programme is to provide the template and the documented evidence to support any change, along with a how-to guidance for implementation in a stepwise manner across every hospital. The metrics for measurement are being developed, with hospitals required to report on progress, followed by assistance locally, if required, for any difficulties in implementation. One of the most exciting parts of this programme is the innovation arm. So we've developed a relationship with the Medical Devices Manufacturing Centre at Heriot-Watt University. As well as established medical industry partners developing new technologies, there are many small startup companies keen to develop new tools and new ways of working with the NHS. We currently have pilot projects underway with Pure Water International, whose filtration device removes microplastics and pharmaceuticals from waste laundry water, as well as recouping the heat energy. Novus Designs, who can provide sterile water locally using a new low-energy vapor distillation system. And Tiny Air, who are developing a new cold water, no detergent pre-cleaning system for surgical instruments. We must remember that about 80% of our healthcare carbon footprint is due to clinical decisions. And this programme is one step in a process which I hope will embed environmental sustainability in all clinical and managerial decisions. Delivering on all these actions will take time and effort, but there are reasons to be hopeful about the beneficial changes that we can all make together. Thank you for listening today.